I was taught in medical school that a positive urinalysis, meaning the presence of white blood cells or leukocyte esterase or pyuria hereafter, meant that inflammation was present, and inflammation meant infection, and infection meant antibiotics. But what if I were to tell you that pyuria, or pus in the urine, was a normal finding in asymptomatic patients as well? In a study of nursing home patients without any symptoms, about half had pyuria. About half of these patients with pus had bacteriuria. Looking at it the opposite way, about 40% of these patients in the nursing home had bacteria in the urine, and of those, only 60% had pus. So to me, these numbers suggest lack of a consistent association between pus and bacteria in this population. And these are asymptomatic patients. Even in a younger cohort, asymptomatic pyuria was extremely common, with 20% of a young female's days being spent with pus in their urine. If this is the case, how do you trust a urinalysis to confirm true infection? In this study, the positive predictive value of pyuria for bacteriuria was only 4%. This is significantly worse than a dice roll of a 12-sided dice for your D&D game. Okay, but what about if patients that have clear symptoms of lower urinary tract infection? If we use a positive culture as the gold standard for this patient population, utilizing a urinalysis alone strategy leads to 52% overtreatment, meaning that half of the positive urinalyses have negative cultures. Like any test, you can jigger with your thresholds to improve performance, but urinalyses are a better test for ruling out infection than ruling it in. Inflammation can be normal in the bladder with and without bacteria. Only with the correct clinical syndrome, and ideally a positive culture, can you be sure an infection is present that requires antibiotics. As soon as you throw a rubber hose into someone's urethra, there's going to be irritation and inflammation that can be detected on urinalysis as pyuria. Urine from a Foley with pyuria is obvious and should be expected. Protocols that use the urinalysis to reflex to a urine culture when positive are less helpful in patients that have Foley catheters in place, and that risk goes up with time. Some studies have even suggested positive predictive values as low as 30% in patients with urinary catheters when you're using a urinalysis. You really can't trust pus. I was taught that pyuria predicts infection, but lie detector said that that was a lie. Even though pyuria is good for ruling out, or the absence of pyuria is good for ruling out infection, and should be considered to be a prerequisite when present for the diagnosis of UTI, it correlates poorly with symptomatic disease and bacteriuria. In fact, intermittent pyuria is probably just part of being a human being. Patients with a positive urinalysis for leukocyte esterase, nitrate, or white blood cells do not all need to be treated. This was the second in a series of lectures that you can find on our Viper YouTube channel. Take a listen to our other 9 myths about urinary tract infection that get mistaught in medical school, and let me know if you have questions.